Verteball, and this time I want to talk to you about the Iliopsoas, or your hip flexors. Now, a lot of people don't know that the hip flexors connect the hip actually to the low back. So for some of the people who come to my office who complain of low back pain, actually start to look at the Iliopsoas. So before I tell you how to use the Verteball on it, let me tell you a little bit about it. So the Iliopsoas is actually comprised of two different muscles. One's called the iliacus, and that sits up along the hip, and the other one is called the psoas, which attaches into your spine. Right about belt line, they create one muscle, and that attaches to your hip, or the front of your thigh. So when we have problems from being seated for long periods of time, if our posture is not great, the iliopsoas shortens up, and that can create some low back problems. Now, historically, it's been pretty tricky to get in there because the iliopsoas sits so deep. It sits behind your stomach, behind all your intestines, on the front of your spine. So what we really need is something that has a lot of depth, like Verteball, to be able to get into that muscle and massage it. So let me show you how to use it on the iliopsoas to see if you get relief like my patients do too. So let's take a look. When you put it, you want to put it on the wall. I like a little bit of a corner here, something that we can get our bodies into. When we get it, we want to start a little bit lower, so a little bit below our front hip bone here. So in essence, right about belt line as well. So we want to release the ball from the base, and we're going to simply attach it into the wall. Like I said, just a little bit lower than I would have it if I was going to do my hip bone here. We're going to slide the ball back down, and you'll notice it's really nice and secure. We're going to come up into the ball now, and what I want to do is, at first, I can just simply lean in and start to massage the ball. So you'll find that you have the front hip bone here. We want to fall just off of that, or just inside of it, and that muscle runs vertically. So that's kind of the motion that we really want to do. So we're going to lean on the Verteball, and then we're just going to simply come up and down, up and down. Try to relax the abdominal muscles, but you'll feel it. When you get onto that muscle, it's going to be a little bit uncomfortable. Now, for somebody who might have a little bit more flexibility, we're going to want to create tension onto that muscle first, and we can do that by extending our hip. So what I would recommend is just simply grab your leg and pull it back so that you're getting some hip tension. And then again, we want to lean in now. So it's just going to be up and down, going into this vertical motion, trying to get as deep as you can, getting it right around that hip bone. If you're able to get into there, I'd say a couple times in the day, something when you wake up in the morning, sometime around lunchtime, and towards the end of the day, after you've been sitting for so long, the Verteball should help give you relief, help you stand up more upright, and hopefully get you some relief in that low back pain and discomfort. Give it a try. I hope you like it as much as I do. Good luck.